Hi, colleagues. This is Pat Quigley. I'm so sorry that I'm late. I had to actually get out of the main session to be able to get into this, and I was not quite doing this right. So I'm so sorry. And I just want to say to you that I'm Pat Quigley. I'm a nurse consultant. And our time together today is really to answer be able to answer any questions that you might have, to be able to talk with you about what it means to be in an organization launching AvaSure technology when you have your partnerships and with your labor organizations within your hospitals to launch this teller sitter program. So I just like for you to go ahead and enter into the chat, and if there's some way, possibly Mark, to be able to have people be able to share, open up your camera and maybe your microphone and do some sharing with us, because this was really a time, our lunchtime, to just chat about what it means to have organized labor. So we'd love to be able to hear from you. We have many participants that are in the room, so we'd love to hear from you.
Pat, they're going to have to chat you or do Q&A.
Okay, so
they won't appear live.
Yeah, so can I see those chats?
Have a box on the right-hand side of your screen that has the chats.
That's
Just click on the chat button.
And maybe you all could introduce yourself to each other as well. I know we have many people who have much shared experience in working within organizations and having the labor organizations at the table. Hi there, Patrick. And Patrick, do you have a labor partnership organization within your healthcare system? I have found in working with with so many of our, hi Cindy, so glad to have you with us. Marnie. And Patrick, you do have a labor organization that you work with and with your AvaSure program. So maybe you could text, what was maybe your first step in going forward? So glad to have you with us, Russell. I have worked with so many of our VA medical centers, and our VA medical centers, excellent, Patrick. So it was a very collaborative work to get started. Absolutely. And myself, my legacy is in the Department of Veterans Affairs and helping with many of our VAs to go forward in launching their programs with their labor partners. I can see we have, so I think Patrick has that labor partnership and collaborative program. That's terrific. And please keep sharing. We'd love to hear from you.
Patrick, if you turn your camera and microphone on, you can share live with Patricia.
Oh, that'd be terrific. Thank you. But I was going to see with the Department of Veterans Affairs, we have done, did I hear someone get to start to share? Please, you're welcome to come on because this really was just a lunchtime conversation about what it means to bring our partnerships together, our labor partnerships through all of our commitment to safety. You know, when we started launching the AvaSure program within the VA, which is where I was starting to share, we had a lot of concerns by our labor partners that this was going to replace nurses. This was going to replace the nursing staff, that this was going to really change their work environment, change their position descriptions. And some of our people who were sitters really wanted to be able to stay in those sitter positions. So it was all about bringing people back to the mission. What is our mission? That mission is patient safety. And how can we all work together for patient safety? Cindy, were you going to do some sharing with us?
Oh, can you hear me?
Yes, I can. Absolutely. Thank you.
Sure, I'll be happy to. Sorry, I didn't realize my mic was on. I guess now flip the switch. Um, so we've been using the AvaSure cameras for I guess 2, 3, 4 years now. I guess I just acquired the directorship over this piece of our organization just recently with this last surge of COVID. So we've been really challenged with our CNAs, certified aides out on the floor, helping our nurses. Of course, that they fall into the
Cindy,
big
it's just being,
hospital.
excuse me, just a little bit. It's just a little bit hard to hear. Can you speak a little closer maybe to the microphone?
Yeah, let me see if I can do that. Is that better?
Just a little bit louder would be great, because I know I can see that you've had a sitter labor pool
Yeah,
across trained aides. I saw your chat here monitoring with the cameras.
right. Is that better?
Yes, please try again.
Okay, how's that?
Good.
Okay, so I have not been the leaders in the leadership over this department for very long, but we are growing. We've expanded to 2 other campuses, and it's been a challenge to have enough sitters because we cross trained our officer monitor team to go out as sitters on the floor for some of our higher risk suicide patients and things like that. So um, it's a very, very good product. We're still teaching our other campuses that we've stretched out to um, just exactly what our purpose is and how this interacts with our patients and with our nursing staff. So it has expanded our reach and be able to keep our patients safe from falls or harm to themselves or others. So
It sounds like you've been very successful in launching your program then across your multiple campuses and bringing people together.
yes, I feel like we have. And our documentation's better. We had to challenge all of our centers were documenting every single little thing. So we had thousands upon thousands of uh, good catches and things like that. So we were having to pull back a little bit on, they don't have to click off every single little box so that it's not skewing our data that we're collecting on it. So we've had our challenges with it, but for the most part, it's done what we wanted it to do.
Yes, that's really wonderful. And thank you so much for sharing. And I can see in the chat too that, let's see, we have other people who have a labor program. Patrick, did you want to share with people? Are you able to unmute your microphone and be able to let us see who you are?
Sure. Hi. Can you see me?
Thank you.
Thank you. So yeah, can you hear me good?
Absolutely. Thank you.
Okay. So yeah, so I think when we first started the program, we initially kind of looked at like the cost. We worked with AvaSure to kind of figure out like a contract plan. It was very complicated in the beginning because it sounded like we had like some of the other Kaiser facilities had a contract with other products out there. And so that was, I think, the main issue. And then, of course, trying to figure out the like the time of the ROI and kind of like mapping out the finances of it. Right after that, as soon as that was accomplished, we had worked with our labor partners that were going to be assigned to the work. And so we had a sister hospital. We're in the Northwest, we're in Portland, Oregon. And our sister hospital in Southern California had been working with with AvaSure already. So we had worked with them. We flew a bunch of labor reps and management representatives to like learn the system. It was very good that we worked with them from the beginning. I mean, of course, the finances and trying to figure out whether the product was the right thing for us was one thing. But then once we found out that it was indeed something that could work for us, and the return on investment would make sense. We started to engage with labor as quickly as possible. Um, I think that made the design of the work a lot easier. Of course, as the program manager for the telesitting program in the Northwest, it's one thing to like operationalize it, but to actually do the work, that's when labor comes in, and that was very helpful for us. So our success comes from that. I think early engagement with labor definitely helped the success of the program. And some of the original people that had gone to California to observe the system over there are still a part of the program today. So, and they're like kind of the founding people, founding fathers and mothers of our telesitting program, and it's been running for 3 years now. And it's definitely reduced our one-to-one sitter cost. There are still days where there's a need for one-to-one sitting because of the acuity of the patients, but otherwise, overall, it's a success.
That's great, Patrick. And please feel free to stay in view and stay on the on the microphone. And anybody else who has a program that you've already implemented with you, please join us in view and also on the microphone as well. And I see in the chat that we have Marnie, who's getting ready to implement the program across two labor partners within your organization there, Marnie. And I would like to share along with Patrick that that we were very similar within the VA. We brought our union leaders to the table, even at the very onset of being able to plan for bringing AvaSure into the program. Sometimes it ended up involving some renegotiation of contracts and adding in new language in the contracts, but all of the focus was always about patient safety, because that's our core mission with all of us as we provide care. Administration, clinical staff, labor people, is it's all about patient safety. So it was never ever, as I mentioned, about replacing staff. People get repurposed because we can, help people be back at the bedside and stay at the bedside. But we also had union members who wanted to be telesitters. So helping them to appreciate what that role means. It's not going to compromise any kind of salaries, it's issues, it's jobs and making sure that people aren't marginalized. But I think really very much the key is making sure that you have people always there at the table. In representatives, we have so many documents that have been prepared to help with the negotiations with labor and the communication systems and the marketing with them that I know AvaSure is more than happy to share with you. So who else would like to? I hope, Marnie, that was helpful to you, but make sure you bring everyone to the table and do everything you can to dispel some of the might be replacing staff. That has always, I think, been one of the biggest issues. Don't you think, Patrick?
Yeah, that was actually one of the concerns in the beginning, like because beforehand we were trying to get people above core, so we were paying overtime staff. And they were concerned that not only the overtime was going to go away, but they were worried that we were going to downsize our CNA workforce. And that simply wasn't true. The like you said, the repurposing of some of the staff. So instead of having our average, I think, of one-to-one sitters back then before we started were probably 8 per shift. 8 sitters per shift, and because of this we've decreased it, but there's also like the role of the telesitter itself that needs to be manned. So I think people forgot that we're not, it's not a computer doing the sitting work. There's actually people that are able to do that. The other thing that I wanted to add was, since then, late in 2020, we started a hub and spoke model to work with our other Kaiser hospital here in the Northwest. There's just two. But again, we engaged with labor when we started thinking about that. So again, we started our conversations with labor pretty soon or pretty early to make sure that they're on the table as far as, you know, changing kind of like our model is concerned. There were a few things that were amended and changed as far as like, you know, the contract or like the work.
Yeah.
Yeah, but very minor, and it wasn't something that was, you know, it wasn't a very big negotiation kind of conversation. It was more of trying to make sure that everything's in line and we're all on the same page. So again, early engagement, I can't stress enough, early engagement is definitely something that helps.
Thank you, and thank you for sharing about the hub and spoke model, because we have some chat in here as well from Russell Walls, who we're so excited. You're getting ready to implement this program across 5 hospitals. How exciting is that? And that you will be the manager of both systems, and you're looking for the advice. And I think, Patrick, you have that advice too. But you know, each hospital is going to be different. Each hospital has its own culture, just like every unit has its own culture. But bringing that staff together, deciding on where you're going to have your, you know, your, if you will, command center for the, you know, to be able to manage all of that monitoring, bringing the staff together, the monitoring staff together, so they support one another, and then setting up your communication system so the telemonitors know who to be able to communicate with the patients that are assigned. So there's a lot of help to help you with moving forward in that hub and spoke model. And Russell is saying that he would love to even plan a visit and go visit someone who has this in place. I don't know where you are, Russell, but I know your AvaSure technology staff can also help you know organizations in place. So just as like around where Patrick is, you're with Kaiser, and where's your location, Patrick?
In Sunnyside Medical Center over in Portland, Oregon.
Portland, Oregon.
Yeah.
So, you know, Russell, the AvaSure technology, or your AvaSure staff person will help you to know which facilities are around you that have a hub and spoke model and help you with those connections so that you can indeed go visit an organization. That would be terrific. And I see Russell just entered into the chat that he's in Lynchburg, Pennsylvania. Or excuse me, yeah, did I get that right? Let me just see here. I'm keeping up with my chat here. Yeah, Lynchburg, Virginia, excuse me. So there's so many resources to be able to help you. The other thing that I think is really important in working with organized labor is to always celebrate in success. You know, as you launch the program, to find ways to celebrate success with the monitor staff and their connections with the staff at the clinical unit. You know, those good, so the data that you're going to get, because the ORNA database has so much data to help you look at efficiencies and effectiveness and the amount of interventions that the monitor technicians have with patients to help prevent adverse events. It's not, the adverse events, quite frankly, are quite rare under observation, but there's a lot of good saves. So when you can help people join together, who, you know, launching the program, the sharing and early successes, the successes that you have with going forward with over time, I think is really important to really be evaluating together. The effectiveness of the rollout, the effectiveness of the implementation is really important with everyone at the table.
I think just to answer Russell's, or try to give him an idea of how to be successful with
5 hospitals.
5 hospitals. I think one thing is trying to do. I called it a dog and pony show, or what is that? Like you have to take your show over to the hospital that you're going to. It's very important for them to see what the telesitter is looking at, because I think there's a misconception where some of the nurses or some of the hospital staff that haven't seen the product itself, live in action, they seem to think that they see everything all at once. And I think that there's a concern over there. And like, I mean, some of it's like, for example, if the patient goes to the bathroom and you don't move the camera, they have this notion that they can still see because it can see the whole room. You can pan through the room, but it doesn't pan all the time. So I think that they have to understand what the capabilities are, to be able for them to be like, when they're with the patient, they know what they're looking at, or what the telesitter is looking at. I mean, it's definitely a great tool, and it definitely helps. And I think knowing what it's capable of is key for the other people that are not within, the hospital where the spoke is coming, or the hub is coming from. If that makes any sense? Our hub is in our hospital over here, but so the people in our hospital understand it immensely. There was a lot of opportunity when we began with the spoke hospital, because they didn't quite understand in the beginning. But yeah, as soon as we did a little bit more of education with the other hospital, there was a bigger understanding of it.
Mm-hmm. Thank you for sharing. And Russell's thanking you as well, Patrick.
Oh, thank you.
Yeah, and really, West has put in the chat to all of you. Anyone else who wants to be able to, show yourself, to be able to open up your microphones, just let us know, because you can be here on stage too. We're all doing this together. And we had Janelle has been asking for help on learning more about the labor pools. Who would like to share about the labor pools? And Janelle says that she has 16 hospitals. They have 16 hospitals in a hub and spoke model. So Janelle, would you like to, come onto the stage? So West, if you could help Janelle be able to share. And then anyone who can help with about the labor pool, share about your labor pools and how that's working for you. So West is trying to provide some technical support for you.
Hi.
There she is. Hi.
Hi.
Thank you for joining us. Well,
Yeah.
everybody joining us, but.
So I'm the telemedicine manager at AvaSure. We have what everybody is talking about right now. We have a centralized telemetry. We have an EICU bunker. We have a virtual nurse bunker. And then we have a telesitter bunker. Our telesitter bunker, all of our sites are off-site from the hospitals, but AvaSure has all of these systems in the 16 hospitals through New Orleans or Louisiana and Mississippi. And I was trying to get more information about the labor pools, because one of our biggest challenges is always being able to staff to monitor the number of cameras that we have out amongst all of the sites. And we have 111 cameras, but we're about to pick up 70 more. And
wow.
So we did, when the program started in 2016, we had CNAs from the hospitals that were going to retire, but did not want to retire fully. They came over to the program. We've had a lot of new grads or nursing students, but we only can keep them for a year or two, because once they graduate from nursing school or MA school, then they move on in the organization. So that is my biggest struggle, is always finding a way to have a continual staff for our turnover program. I mean, I feel like this is the entry level program into AvaSure, and everybody starts here and works their way up. But we don't have a pool of employees for our program.
So does Patrick, do you have comments to share with her and others that would like to share? You can chat in if you're not, or just open up, you have your microphone opened up.
No, I don't have. So we have our it's manned by our CNAs over in the hospital. So we have a CNA float pool, and I manage that department as well, and I kind of like distribute within that group of core telesitters. Otherwise, and they watch both hospitals, but yours sounds like a very complex, way more complex than what we're doing over here. 16 hospitals is impressive, to be honest. I was like, when you said 16 hospitals, that
I know.
the
As I
whole
read
city
that, I had
over
a
here.
question.
Yeah,
That's
I feel like
phenomenal.
Oshner just keeps, you know, partnering,
Yeah.
growing with all the hospitals
Yeah.
in the Southeast. And so we do have, we actually had to make we're in the process of making our job description different from the PSA, because that's what they were patient safety attendants, because they are strictly here. They don't ever go to the bedside. We don't require them to keep a CNA license. That was one of the ways that we were able to get more people to be able to do the job, was not having to require the CNA license.
Yeah.
Because that's a big requirement. And then you have to decide, we don't allow the telesitters to watch one-on-ones. They use actual bodies for one-on-one patients. And so we have a department that just does patient safety attendance, and they staff all of the one-on-one if they have any one-on-one patients. And then if it's just a regular sitter patient, not behavioral health, then we watch those patients.
Mm-hmm.
But there's so many of those patients. I mean, way more than the one-on-ones.
Just out of curiosity, with 16 hospitals that you're working with, how many can you guys watch at one time?
So we have the regular AvaSure screen, so we can have 16 on the screen at one time. The highest we've been at this year, we've had 87 active cameras, but we have 111 cameras like out in the field that can be used. But again, we're growing this summer, where they're adding 70 additional, and the hospitals keep asking for more and more cameras. But I'm like, I don't have the staff to support all of the cameras that you guys are wanting.
Yeah, absolutely. You got to staff it up. And, one of the things that I learned during this conference too is that AvaSure has telesitters themselves.
Mm-hmm.
So they have staff that can complement your staff if need be.
I did not know that.
Yeah, that was in the opening remarks.
I would love that.
Yeah, that was in part of the opening remarks. So, contact your AvaSure project manager.
Mm-hmm.
And then let's see. I just want to make sure that Russell, you saw that your project manager has connected with you in the chat. Kevin Dumler has shared with you that he's your project manager. So that's wonderful to have our project managers in here as well, joining us. But yes, that is a support program that now AvaSure is providing.
Mm-hmm. Okay. Yes, I will reach out to.
And I know, even when some of our in-person regional symposiums that we have done, I have seen monitor technicians be trained from dietary technicians.
Mm-hmm.
So nursing assistants, people that, as long as they have some clinical background, that, there were, and actually one of them was presented on one of our panels once, was someone who was in dietary, and she wanted to really look and see what it was about, and she got into it. And I know that that's been another, if you will, streamline to find those who would be willing to serve in that position. But also nurses on light duty, modified work duty. I think is really invaluable to have nurses in with the monitor technicians, especially when they're learning to deal with emergent and urgent situations, maybe bounce things off of what they're seeing. but having nurses and modified work duty, limited tired nurses that we're bringing back.
We do. We are like the modified light duty central. They contact me as soon as somebody goes on light duty. I take everybody that is on light duty. Yes.
Well, you know, colleagues, I know we're near at the top of the hour of 1 o'clock, and I just can't thank you enough. I want to thank you, Patrick, for joining me again, and Janelle for joining me again, joining me with this, because you have the lived experience. I have the experience from deployment throughout the Department of Veterans Affairs, but you are living and breathing it. I again apologize for not being able to get in here quickly enough after that extraordinary presentation by John O'Leary. Oh my gosh. I had to realize I had to get out of one program and get into another. So I apologize for being late. But I hope that this has been helpful to everyone. And I just can't thank you enough. And we'll see you in the next session that starts at 1 o'clock. Thank you, colleagues.